Come in.
Good evening, Mr. LaRoche.
Yes, ma'am.
I'm Alicia. I'll be the nurse caring for you tonight.
Good morning. Good night. It's something.
It is. Oh, what day of the week is this something?
Tuesday.
Can you tell me your name and date of birth?
David LaRoche, January 11th, 1976.
Who's the president?
Donald Trump.
Tell me a similarity between apples and oranges.
They're both fruit.
What does the old saying, "Don't cry over spilt milk," mean?
Don't get upset about the small stuff.
All right, so patient is appropriately dressed for the situation, well groomed, height and weight are proportionate, mood is calm, affect is no distress noted. He is alert and oriented ×3. Mr. LaRoche, I'm going to start by looking at your face and your head. Going to feel your scalp. Let me know if there's any tenderness. Have you had any trouble with your hair or your scalp recently?
No.
Scalp is dry, no flakiness noted. Hair is well dispersed. There are no depressions, knots, nodules, no signs of alopecia or any fungal infections. Any tenderness when I was touching?
No.
Next, I'm going to look at your eyes. I'm going to pull your lower lids down. Conjunctiva are pink bilaterally, sclera are clear. I'm going to look up upper lids. Upper lids are pink. Lashes are well dispersed. Eyebrows are symmetrical. Also appropriate hair distribution. Light. If you will look at my nose. Pupils are equal, round, reactive to light. Look at this marker, please. Sorry about that. All right, follow this for me. So equal, round, reactive to light and accommodation, consensualization, all appropriate. Pupils are approximately 4 millimeters in width. To look at your ears next. Let me know if it hurts anywhere. Pinna or mobile. Auricles are symmetrical, no nodules noted. Tragus, any tenderness there?
No.
Negative on the tug test. All right, ears are well aligned, symmetrical, meet up with the outer canthus of the eyes. Next, we're going to look into your ears. Outer ear canal is clean, no erythema noted, no cerumen present. Inner ear canal. Slight amount of cerumen present within the inner ear, no erythema noted. Malleus is noted. Cone of light is present at 5 o'clock. No fluid seen behind the tympanic membrane. Tympanic membrane is pearly gray. Do the same on your other ear. Outer ear canal is clean, free of debris, no erythema. Tympanic membrane, pearly gray, cone of light at 5 o'clock. There are some particles of hard cerumen present. Cone of light here in the left ear is at 7 o'clock. Any tenderness in your ears?
No.
Next, I'm going to look at your mouth. Lips are symmetrical, well aligned, closed appropriately. You will open your mouth for me just a moment to gather my supplies. Open your mouth, please. Stick out your tongue and say ah.
Ah.
Uvula does shift upward. You can stop saying ah. Stick your tongue out, please. Tonsils, no swelling, posterior pharynx, no postnasal dripping, no erythema, no plaques, no nodules noted on the soft or hard palate, no clefting. Lift your tongue up, please. Mucosa is pink and moist. Have any trouble chewing or swallowing, Mr. LaRoche?
No.
Any discomfort in your mouth? No pain? Next, I'm going to feel your throat and neck. Outside. Trachea is midline. I'm going to check your carotid pulse. Pulse is brisk, 2+ on the left. Carotid 2+ on the right. Next, I'm going to listen. No bruit heard. No bruit on the right either. I'm going to check your lymph nodes around your head and neck. Let me know if there's any tenderness. We have the preauricular, no nodules noted. Tonsillar, free of nodules. Postauricular, non-palpable. Occipital, non-palpable. Deep cervical. Any tenderness?
No.
Non-palpable. Superficial cervical. Posterior cervical. Supraclavicular. No nodules noted. All right, if you would, raise your arms up for me. Central lymph nodes. Non-palpable. Lateral. No nodules noted. Pectoral. Subscapular. And infraclavicular. No nodules noted, no tenderness voiced. Mr. LaRoche. Look at your arms. Just relax. Bilateral upper extremities. Skin is warm. No abnormalities noted other than some light macules on the forearm, some scarring. There's a slight scab here across the left forearm. I'm going to check your brachial pulse. Brachial pulse, 2+. Radial, 2+. Capillary refill brisk, less than 2 seconds. No clubbing or spooning, no splintering of the nails. Next, Mr. Loesch, I'm going to come around and look at your back and listen to your lungs. I'm going to untie your gown. All right, initial exam of the posterior thorax shows some macules across bilateral shoulders. There's a scar here on the left suprascapular area. Inspiration appears equal. Deep breath in and out. Inspiration is equal bilaterally. No use of accessory muscles noted. Spinous processes, palpable, well aligned. There's some tension noted here in the left cervical area. Right, next, I'm going to listen to you, sir. If you could, every time you feel my stethoscope on your back, take a deep breath in through your mouth. Ready? Lung fields clear, all lobes, no adventitious sounds heard. Next, I'm going to do what's called percussion by tapping on your back like this, sir. Good resonance noted throughout. All right. Next, I'm going to check your kidneys for any tenderness. I'm going to be doing that by punching your back with my hand in between my fist and your back. Let me know if this causes you any discomfort. Any pain?
No, ma'am.
Back up for a moment. Come back around. I'm going to look at your chest. So I'm going to pull the gown down. All right. Shoulders are well aligned. Chest is appropriate. Anatomical portioning, a good 1-to-2 ratio. No pulsations visualized. There is some scarring present here mid-sternal. Let's listen to you. Lung fields are clear throughout, bilaterally, no adventitious sounds heard, no crackles, no rails. Hair is appropriately dispersed. Let's see if it's okay. I'm going to listen to your heart. Just breathe normally for me. Do the same thing, just flip my stethoscope over. And we have the aortic valve, pulmonic, Erb's point, tricuspid, and mitral. have the clock locked or I'm going to listen to your heart rate for 1 minute. All right, so heart rate is regular. Good S1, S2 heard throughout all areas. Rate was at 65 beats per minute. I'm looking for a PMI. PMI is present, non-bounding. There were no extra sounds heard in the heart, no clicks, rubs, gallops, no S3, S4. Next, Mr. LaRoche, I'm going to ask you to drink a sip of water. So I come back and I'm going to check your thyroid gland. What I'm feeling for is your thyroid gland is it can be a nodular type of gland if it's irregular, but it's right here around your trachea. Here, your Adam's apple is also called thyroid cartilage, and your thyroid is just below that. Okay, if you would, take a sip of water, please. Relax your hand. Good swallow, no nodules or goiter present. Any tenderness?
No.
Like another drink of water?
Right.
All right, next I'm going to ask you to lay down. I'm going to look at your stomach and listen to it. I'm going to tuck this gown into the top of your underwear here. All right, so upon initial exam, there is normal male patterned hair distribution. Umbilicus is midline, no protrusions noted there, no pulsations, no visible herniations, no scars present. Any difficulties with your bowel movements recently?
No.
Any discomfort in your abdomen?
No.
Abdomen is round, somewhat protuberant. All right, I'm going to start by listening to your stomach, just listening for normal bowel sounds for the digestion of food. Okay. Bowel sounds are normal active in all 4 quadrants. All right, next I'm going to do that percussion again that I did on your back. Let me know if there's any tenderness, and I'll stop. Good tympani noted throughout. Next, I'm going to palpate your stomach. I'm going to be feeling with a light touch, just feeling for any types of masses or enlarged organs that you might have there in your abdomen. Let me know if you have any tenderness or pain. Any discomfort?
No.
Okay. Now I'm going to do it again, but it's going to be a little more pressure this time. Ready? Any tender there?
Yeah.
All right.
Little ticklish.
Okay. Patient complained of some sensation here in the left lower quadrant, just above the colon. Bladder is non-palpable, non-distended. So I'm going to check your liver. Liver is not enlarged. Palpated just below the costal margin. All right, looking, see if there's any aortic pulsations visible here just above the umbilicus. None is noted. I'm going to feel, see if I can feel your aorta. No bruit is felt. I'm going to listen to the arteries in your stomach. Down lower, feeling for your femoral. So the 2+ pulsation heard in the aortic, renal, iliac, and femoral arteries. No bruits were heard. All right, Mr. LaRoche, I'm going to take this out. Good, stay laying like that. You would lift your head up for me, though. Pull it back. No diastasis recti noted. Relax your head, please. Go ahead and check the range of motion in your lower legs while you're comfortable. Are you in a comfortable position?
Yes.
Okay. Put it down. Going to check for any warmth or tenderness. No warmth or swelling noted in any of the joints bilateral extremities. All right, now if you would, bring your knees up to your chest for me. All the way up to your chest as far as you can. All right, look right down. All right. Flex your feet, pull your toes up to your nose. Now push down towards the wall. Okay. Turn. Turn. Good. Now if you would, I want you to spread your legs. Keep them straight, spread, and bring them back. Cross one foot over the other. Now open and do the opposite. Good range of motion noted throughout the joints bilaterally. Full range visualized. If you would, if I could get you to come over and sit on the edge of the bed again. Okay. Going to check in your arms, range of motion. Start with your fingers. And strength noted in the legs. We will check a little bit farther. All right, open your fingers for me. Keep them open. Good. And close them. Squeeze my fingers. Pull. Push. Pull. Push. Strength is 5-5, bilateral upper extremities. Full range of motion noted within metacarpals, wrist. Any discomfort?
No.
No crepitus has been noted so far. Elbow, full range of motion. Wrist open, close, down. Any discomfort?
No.
Elbow, bend. All right, now take your arms for me and circle them up and around. All right, cross in front of you, now behind. All right, full range of motion in the shoulders bilaterally. Next, I'm going to check your sense of sensation. What I'm going to be doing is checking for a soft and a sharp touch. I'm going to have you close your eyes and you let me know if it is a sharp sensation or a dull sensation that you feel. Okay? Close your eyes for me.
Soft. Sharp. Soft. Sharp.
Okay, very good. Next, we're going to do vibration on one of your joints. You'll open your hand for me. You let me know when you feel the vibration begin and when it stops.
Okay. Felt it immediately.
Okay, let's try that again.
No.
Close your eyes. Say now when you feel the vibration, and then now when you feel it stop.
Now.
Okay. Upper extremity distal sensation vibration is intact. All right, now I'm going to check on your lower legs, the sense of sensation. So it's going to be that soft or dull sensation and sharp. Pull your pen on your sheet. Close your eyes, please, and let me know what you feel.
Soft. Sharp. Sharp. Soft. Sharp. Soft. Sharp.
Okay, and open your eyes for just a moment. I'm going to check that vibratory sensation on your toes. So once again, I'm going to have you close your eyes. You let me know when you feel the vibration and when you feel it stop. Okay, very good. So sense of sensation is present both distal and proximal bilateral lower extremities to both soft and sharp. Vibratory sensation was present. Going to check your pulses. Just relax for me. Radial pulses are brisk but not bounding at 2+. Brachial, 2+. Posterior tibial, 1+. Dorsalis pedis, palpable at 2+. Capillary refill, The toes is brisk, less than 2. 1 to 2 plus peripheral edema. Bilateral extremities. Next, I'm going to check your reflexes. Good. For your arm just a moment. You would just relax your arm. I want you to think about flexing your foot for me. Okay? Just relax your arm. Here. Just relax. A 2 plus reflexes noted. Good extension there on both the brachioradialis, the biceps, and the triceps. Next, I'm going to do it on your knee. Just relax. If you would, grasp your hands like this for me and push them together. He is very ticklish on his feet. All right, 2 plus reflexes noted there on the patellar and the Achilles tendons. All right, relax your hands. All right, next I'm going to check your cranial nerves. So I'm going to start with your olfactory nerve, cranial nerve 1. If you would, I'm going to have you close your eyes, block one of your nostrils, and inhale. Okay, so if you would block your right nostril for me, eyes closed, tell me what you smell. That is an orange extract. Now if you will unblock your right nostril, block your left, and inhale. What do you smell?
Mint.
That is a peppermint extract. All right, so olfactory nerve 1 is intact. Next, we're going to check his optic nerves. If you would look at me, I'm going to check what's called the red reflex in your eyes first. This is actually just part of a normal eye exam. Red reflex is noted. Red reflex is present bilaterally. All right, Mr. LaRoche. I'm going to cover one eye, and I'm looking for any type of variations in your muscle strength. Okay, so just look at my nose. No strabismus is noted. Can you see those letters over there, sir?
Yes, ma'am.
Okay. You would cover your left eye. Read that lowest line for me.
FLUDBVP.
Okay, uncover that eye. Now cover your right eye for me. Read the lowest line possible that you see clearly.
FLUDBVP.
Okay, uncover. Try relax. And with both eyes, read the lowest line that is clearly visible for me.
FLUDBVP.
Okay, patient presents with 20/20 vision bilaterally. We did test some of the ocular motor nerve sets there. So optic nerve 2 is intact, ocular motor nerve 3 is intact, trochlear nerve 4 is intact, and abducens we did earlier by checking. There was no nystagmus noted. The abducens nerve 6 is intact. Next, I'm going to check your facial nerve. right, if you would, puff out your cheeks for me and smile. You can release the puff. Now frown. Okay, facial nerve is intact. I'm going to check the trigeminal. If you will close your eyes, let me know if you feel a soft or sharp sensation.
So. So.
Is it the same on both sides?
Yes.
Okay, close your eyes again.
So. Sure. Sure. So. So.
Okay, open your eyes. Trigeminal nerve is intact, able to differentiate between soft and sharp sensation. You would clench your jaw for me. Master muscles. Open your mouth. Now resist. Head down. Good. Close. Glossopharyngeal, we checked earlier with the swallowing function of the thyroid. Spinal accessory nerve, if you would, push against my hand. And this way. And shrug your shoulders. Resist. Good. Sternocleidomastoid and trapezius muscles. Good 5-5 strength. Hearing test. I'm going to come behind you and check the hearing on your ears, okay? All right, Mr. LaRoche, what I'm going to be doing is first I'm going to cover one ear and whisper a word. You tell me what you hear, okay?
99. 54. 88. 50.
Okay. Hearing was impaired somewhat on the left side. Next, I'm going to use this tuning fork. I'm going to cause it to vibrate, place it on your skull. This is called bone conduction, where you're actually somewhat hearing it through the bones of your head. You let me know when you hear the sound and when it stops.
Okay. So.
Was it louder on one side or the other, or did you hear it equally?
It's loud over here.
Okay, so it's still appearing to have some left-sided deficits. Next, I'm going to activate the tuning fork. I'm going to place it back on your occipital bone. You let me know when you hear the vibration, when it stops, and then I'm going to move it to the side of your ear. Let me know when it stops.
Oh, yeah. It's gone.
Right ear air conduction was greater than bone conduction. Next, I'm going to do the same process, placing it back here behind your ear and then beside you. So let me know when you no longer hear it here, so I can move it to the side, and then let me know when you no longer hear it.
I can hear it. Gone.
down the left side. Air conduction is greater than bone conduction. Let's see. Skin was warm and dry, bilateral lower extremities. There's some varicosities noted here, medial aspects, both legs, just lateral to the patellar surfaces. Also here near the ankles, medial aspect. Right great toe has had the toenail surgically removed with some scarring present to the nail bed. All right, Mr. Roche, if you would, stand for me. I'm going to look at your spine. So if you let's take a step forward. Cervical curve, somewhat normal. Little bit of kyphosis noted here on the shoulders between the the thoracic and cervical spine. Some lordosis noted here in the lumbar area. Otherwise, curvature is near within normal. If you would, take one step back for me. Okay. Bend over and touch your toes. No scoliotic curve noted in the spine. Stand up. I'm going to check your range of motion. If you could, turn your head side to side, up and down, and then try to touch your ears to your shoulder. Range of motion within normal and full to the cervical spine. Next, I want you to twist. Keep your legs still. All right, now we're going over to the side, and back. Okay, and forward. Thoracic, lumbar spine, range within normal limits, full range of motion noted. Shoulders are well aligned, iliac crest, symmetrical. All right, I'm going to ask you, take a few steps to the wall, turn back around. Stop. Gait was smooth. No staggering was noted. If you would, we're going to work some more on your vestibulocochlear nerve. Check your balance. Okay. So close your eyes for me. All right. No swaying noted. You can open your eyes. Right. Raise your hands. Put your feet together, please. Raise. Place your head back. Close your eyes. All right. Negative Romberg. All right. If you would, raise one foot. Equilibrium seems appropriate. All right. If you would sit back down. All right. If you would step back and have a seat for me. All right. Next, I want you to take your left foot and run it down your shin with your heel. Okay, now do the same thing. Sorry, that was violence.
It's okay.
I want to apologize. Heel shin was appropriate. All right, now let me see your hands. If you would, touch your thumb to your forefinger, middle finger, ring finger, pinky. Now go back the other way and back down. All right, Fine motor skills are intact. Though. Touch your finger to my finger. Now touch your nose. And touch my finger. Touch your nose. My finger. Your nose. My finger. Your nose. Fine motor coordination is intact. If you would, well, I can check this while you're sitting. I need to check your Babinski reflex. This shows if there's any type of lesions possibly somewhere on your brainstem. What I'm going to do is I am going to run this on your foot.
I'm sorry.
Negative Babinski. There was no curling of the toes. I have not looked in your nose. If you would. The ears are patent, as we tested with the olfactory nerve exam earlier. Turbinates, visualized, both upper and lower. No swelling or erythema noted. No nasal drainage is seen. Slight septal deviation to the left, otherwise nose is symmetrical. All right, I'm going to look at the paper. So olfactory, that's your sense of smell, cranial nerve 1, optic nerve 2, we checked with the Snellen exam. Through confrontation and accommodation, ocular motor, movement of the eyes, 6 cardinal fields, trochlear, the lateral gaze, there's no nystagmus noted, abducens, trigeminal nerve 5, had good 5 out of 5 jaw strength, was able to identify touch, facial nerve, was able to utilize all facial muscles appropriately. Auditory, we did the Weaver and the Rhine, the Rene. Some hearing loss noted in the left ear. Glossopharyngeal, nerve 9, we checked with the swallow exam with the thyroid. We have not checked the vagus nerve 10 or the hypoglossal. All right, for the vagus nerve 10, I want you to stick out your tongue, please. I'm going to check your gag reflex. Now we checked the uvula. It was midline. It did rise when you said ah. Gag reflex is intact. And for the hypoglossal, stick your tongue out for me. Side to side. Up and down. Tongue strength is apparently 5 out of 5. That's it. Thank you for your time, Mr. LaRoche. I'll let the doctor know these findings. He'll be in to see you shortly. I would recommend that you follow up with an audiologist for your hearing loss. Best of luck to you. All right, addendum to physical assessment. All right, close your eyes, please. Hold out your hands. I'm going to place 2 objects in your hands. You identify what they are, please.
That's a coin.
All right.
That's a paper clip.
Correct. So stereognosis was appropriate. Both hands. Now I'm going to write a letter or a number in your palms. Please identify what it is.
G. A. S.
with the second attempt, graphesthesia was correct in the right palm. On initial attempt, it was correct in the left. Next, I'm going to raise or lower a finger on each of your hands. You let me know if it is going up or down.
Up. Up. Down. Down.
Okay, relax your hands for me. Next, I'm going to check the range of motion of your temporomandibular joint. You could open your jaw for me and close. Any discomfort?
No.
Any popping? I felt no crepitus or popping either. Full range of motion in the temporomandibular joint. And open again and resist. Good strength there. Now, like we did with your fingers, with identifying if toe is the finger is being moved up or down, we're going to do the same thing with the toes.
Be careful.
Okay. Close your eyes, please. Let me know if it's going up or down.
Up. Down. Up. Up.
Okay. Distal sensation is intact. I do believe that is all. Thank you.